Hello, I am Dr. Elizabeth Wang, and I'm one of the pediatric cardiologists with UT Physicians and Children's Memorial Hospital. And today I'm going to talk about pediatric chest pain because it's a very common problem in the pediatric population and it can be a very scary one. So whenever most people think of chest pain, they think of a heart attack. And the good news is that the incidence of heart attack is very low, less than 5%. So it happens mostly in the teenage years, and girls and boys are affected equally, so let's get started. The definition of chest pain is any type of pain in the front of the chest or the rib cage. There are many types of pain ranging from a vague discomfort to sharp stabbing pain, and it can last anywhere from seconds to a constant ache. And depending on what is causing the pain, the duration and characteristics of the pain will vary. There are many causes of chest pain in children. There are non-cardiac chest pain and there are cardiac causes. And again, most of the common causes are going to be the non-cardiac causes, which include musculoskeletal, gastrointestinal, pulmonary, psychogenic, and infection etiologies. And then cardiac causes include structural heart disease, dysrhythmias, and myocardial causes. So let's start with the non-cardiac chest pain. Since it is most common, let's get into it. Breaking down the causes of non-cardiac chest pain, the first one is going to be musculoskeletal etiologies, and they include costochondritis, which is the inflammation of the joints that join the ribs to the sternum, trauma, so any blows to the chest, and muscular strain, which is caused by overuse. This is not uncommon when we have a child who has recently started an exercise regimen when they were previously less active. The next one is gastrointestinal causes, which include gastrointestinal reflux and foreign bodies. And then the next one is pulmonary, which include pneumothorax, where the air gets into the chest cavity and causes compression on the lung. Common associations include asthma, cystic fibrosis, Marfan syndromes, and subpleural blebs. Asthma is another common cause of chest pain. When the airways go into spasm and make it hard to breathe, it can cause pain. And because of constant cough, the chest wall muscle strain can occur and cause chest pain. The next one is pulmonary embolism, and this is where there's a blood clot in the blood vessels that bring blood to the lungs. It is very rare in children, but if you have a history of clotting disorders, venous thromboembolisms, any type of syndromes, malignancies, recent surgeries, or oral contraceptives, this can be a cause of chest pain. Pleural effusions are when fluid are on the lungs, and it can be caused by infection. Pleural effusions are another cause of chest pain, and it's when there is fluid in the lung or around the lung, and usually it's because of an infection. So it causes irritation to the chest wall, and that can cause chest pain. And last but not least, there's sickle cell crisis. So whenever you have sickle cell disease, there's abnormal red blood cell shapes and they can clump together. And when that happens in the chest wall, it can cause chest pain. Next, we have infectious etiologies, which include pneumonia, which can cause irritation to the lining of the lung, and pleural effusions, as well as pockets of pus, irritation, and inflammation of the airways. Shingles, which is a reactivation of the chickenpox virus and can cause a very painful and itchy rash on the chest, causing pain. And then Coxsackie viruses, which is a common cause of the common cold, and among other things can also cause chest pain. And last but not least, psychogenic causes of chest pain, which are very hard to identify, and any type of stress and anxiety can cause this. Clues that this is the reason for chest pain can be any history of recent stressful event or a family history of depression that predisposes a child to psychosomatic symptoms. All right, so let's talk about some of the symptoms that are associated with all of these causes. So with musculoskeletal, you'll usually have pain with movement, some type of chest soreness, or the pain will be sharp and stabbing. With gastrointestinal symptoms, you may have burning chest pain that worsens when you lie down, foul taste in the mouth, or drooling. And then pulmonary symptoms can be shortness of breath, wheezing, or coughing. Infectious can be fever, malaise, any rash in a linear distribution. And then psychogenic symptoms can be hyperventilation, a history of a recent stressor event, or vague combination of symptoms. Because it's the most common cause of chest pain, let's kind of go over the musculoskeletal cause. So again, most common type of chest pain in children and adolescents. Generally, it's sharp and it lasts seconds to several minutes, and children can feel anxious when experiencing this pain. It's exacerbated by deep breathing during exercise or rest. It's usually located at the center of the chest or just below the breast. And sometimes squeezing the chest cage or pushing on various chest structures can reproduce the pain. It can last a couple of days to months, and usually the treatment is just rest, ice, and NSAIDs like naproxen or ibuprofen. Now let's talk about the cardiac causes of chest pain in children. And these are the causes we as cardiologists are here to diagnose and treat. And again, they include structural heart disease, dysrhythmias, and myocardial etiologies, so any heart muscle issues. First, it is important to understand the normal heart anatomy and blood flow. The heart has two upper chambers and two lower chambers. The two upper chambers are called the right and left atrium. The two bottom chambers are called the right and left ventricle. They're separated by valves, and the one on the right is called the tricuspid valve, and the one on the left is called the mitral valve. Coming off the right ventricle is the pulmonary valve, and coming off the left ventricle is the aortic valve into the aorta. Next, it's important to understand the blood flow through the heart. So here you can see from the body, when the blood is blue, it comes to the right side of the heart and it's pumped into the lungs, where it turns red and comes to the left side of the heart, where it's pumped into the rest of the body. The first structural abnormality I'm going to talk about is called hypertrophic cardiomyopathy. And this is when the heart muscle is disorganized and it gets bigger, causing a thick heart. And here you can see the wall between the two ventricles is very thick. And so it can get so thick that it can start blocking the flow through the aorta to the body. This is a condition that can be either inherited or can occur without any family history. And chest pain is caused by decreased amount of blood and oxygen getting to both the heart muscle itself and the body, specifically the chest wall. It's also the most common cause of sudden death in athletes, and typically the thick heart muscle starts happening in the teenage years. So if it runs in the family, just because the echocardiogram is normal in early childhood, it doesn't mean that thickening will not develop later in life. So children need to be followed periodically for monitoring. The next structural abnormality I'm going to talk about is aortic valve stenosis. And this is when the aortic valve is abnormal because it's too small or it's misformed. This causes limited amount of red blood to be able to go to the body, therefore chest pain occurs. There is a specific murmur that can be associated with this lesion and can be found on an echocardiogram. And treatment is usually catheterization or surgery. The next structural abnormality I'm going to talk about is mitral valve prolapse. And this is when the mitral valve collapses back into the left atrium when the ventricle squeezes. And it's associated with connective tissue conditions like Marfan syndrome, but it can occur on its own. And the chest pain is because there's poor blood flow to the heart wall or muscle structures. There's no specific treatment for this prolapse if it's mild, but sometimes surgery may be required in the case that it is severe, and it is diagnosed on echocardiogram. Anomalous coronary arteries are another reason for pediatric chest pain. So normally your coronary arteries come off your aorta, where red blood comes through, goes to your heart muscle. When the coronary artery is malformed and comes off the pulmonary artery, then blue blood goes through your coronary artery to the muscle of your heart. Chest pain is caused due to poor oxygen supply of the heart muscle because there's blue blood now going to the heart muscle. And this is diagnosed via echocardiogram, CT, MRI, or angiography. And the treatment is surgery. Other reasons are going to be any type of heart attack, so myocardial infarction caused by Kawasaki disease, which is an inflammation of the coronary arteries, long-standing diabetes mellitus, chronic anemias, and any type of illicit substance that will make your heart go faster, such as cocaine. Next, dysrhythmias can also cause chest pain. So the first one is supraventricular tachycardia. An abnormal spot in your atrium causes a fast heart rate. Symptoms include palpitations, lightheadedness, and sometimes fainting. And treatments are going to be medications or ablations, and we can see this on EKG and Holter monitors. The next type of dysrhythmia come from the bottom two chambers, and they're called ventricular tachycardias. This is when an abnormal spot in the ventricle causes a fast heart rate. And again, symptoms include palpitations, lightheadedness, and fainting. And treatments, again, are going to be medications or ablations, and we can diagnose these from EKGs or Holter monitors. Infection is the next cause of chest pain in pediatrics, and we're going to start with pericarditis. And this is caused by a multitude of reasons, and it's the most common being viral. It's the inflammation of the pericardium, or the lining of the heart, or the covering of the heart, and it becomes inflamed and it rubs against the heart itself. Symptoms include chest pain that's worsened when lying back and better when you lean forward, and there are specific heart sounds that are consistent with pericarditis, and most of the time treatment is supportive. Diagnosis is through the clinical exam in EKG, and you can give NSAIDs like ibuprofen to support the treatment, and generally it goes away by itself. Very rarely, fluid accumulates between the heart and the pericardium, and when this happens, it's called a pericardial effusion. In addition to the NSAIDs and steroids that may be necessary, if there's too much fluid, a procedure to drain the fluid will need to be performed. Next, we have myocarditis, which is the inflammation of the heart muscle itself, and it is also most commonly caused by a virus. Typically, patients present with fever, chest pain, fatigue, and shortness of breath. And there are many lab results that can point to this diagnosis, and the pumping function of the ventricle can be compromised, so the patient may be susceptible to fatal arrhythmias with exercise, which is why sports are restricted with fever. And so we can diagnose this through EKG, echoes, and blood tests. And treatment is largely supportive. Last but not least is endocarditis. And this is the infection with vegetations or little pieces of bacteria on the heart, either on the valves or in the heart itself. Risk factors include cyanotic heart disease, an indwelling catheter like a central line, or a left to right shunt like a PDA, patent ductus arteriosus, or ventricular septal defect, or any type of hole in the heart. Diagnosis is from an echocardiogram and blood tests, and treatments are antibiotics and, if needed, surgery. So the important points that I want you to remember are that the most common cause of chest pain is related to the musculoskeletal system. Less than 5% of all pediatric chest pain is caused by heart problems. When you need to see us is when the chest pain happens during exercise, your child is acting very tired or has a prolonged or unexplained fever, your child has palpitations before the chest pain, the chest pain is associated with fast heart rate, dizziness, or fainting, or when something just doesn't feel right. We as UT physicians in the community are me, Elizabeth Wang Jufrey. I am at UT Physicians at Pearland, UT Physicians at Bay Area Pediatrics. I'm also at the UT Physicians in the One Fannin Professional Building. Adrian Kilgore, who is at Memorial Hermann Memorial City, UT Physicians at Cinco Ranch, and Faustino Ramos, who is at the Memorial Hermann The Woodlands Hospital. Thank you for your time and attention, and to make an appointment at any one of our community cardiology clinics, please call 713-486-6755.